behind me, there are several senior citizens who have also come forward for their third dose. This is the registration area, multiple counters that have been set up.
The message here from the healthcare workers is that everyone should get vaccinated.
Hello everyone, you're watching News Epicenter with me, Maria Shakil, and our top focus at this hour remains the surge in cases that we are witnessing because of the Omicron variant. This new variant is certainly more infectious, and it is leading to a surge in which India has recorded its highest tally in 7 months in the last 24 hours. So this is what we are looking at. COVID wave with fresh infections being at 7-month high and close to 1,80,000 cases in the last 24 hours. But on a positive note, India today launched the third jab or the precautionary dose with an aim to inoculate the frontline workers, healthcare workers and elders above 60 years with comorbidities. About 5.75 crore people are eligible for the third doses in the ongoing drive which has begun today, with 2.75 crore above the age of 60, 1 crore healthcare workers and 2 crore frontline workers. Across the world, 126 countries worldwide have already issued recommendations on booster or additional vaccination, and more than 120 have started administering this additional dose. Top health agencies to scholarly bodies like the MIT, the Harvard have found in their research that booster doses are the only way to fight Omicron and future COVID waves. So with India finally starting this additional dose, what exactly does it look like as far as weeks and months ahead is concerned? Can it really flatten the COVID curve? To answer this question, on top of the show, we have the chairman of government's technical advisory body on COVID, Dr. N.K. Arora. I'm also being joined by Dr. Shashank Joshi. He's the member of Maharashtra COVID Task Force. We have Dr. Sunila Garg, member Lancet Commission and COVID-19 Task Force of India member, and Dr. Chandrakant Laharia, who is the author of Till We Win, India's Fight Against the COVID-19 Pandemic, a renowned epidemiologist. I'm going to go to Dr. Arora first. Dr. Arora, fortunately, here in India, the overall death figures are low and very much under control. How do you see this moving forward? Because experts have suggested, and we have seen that in the first and the second wave, that usually the deaths lag infections by few weeks. Or are you of the opinion that because this variant is believed to be relatively less virulent, less deadly, the overall death numbers in India would be under control, and that certainly would be a very good news?
So, Maria, this is a very important question, both from an individual perspective, individual as a patient, and also from a public health perspective. The global experience shows that there is decoupling of number of cases and deaths, whether we take South Africa, we take UK, or even in other parts of Europe and North America, where the outbreak is raging, there is a number of deaths and proportion of deaths are less. And within India, what we see during last 3 weeks particularly, when we see more individuals and more patients from the community, that all those who are requiring admission are usually those who have concurrent or concomitant comorbidities, just like cancer. They may be admitted with heart disease, liver disease, lung disease, or kidney disorders. They are admitted, and then they need ICU care, and some of them may be dying. So, but overall mortality is less. I would like to say another very important thing. This is initial. Maybe a week later, we will be little more aware about this, that many of the patients who are otherwise seeking care in hospital, and today the standard protocol is to do a RT-PCR when a patient is to be admitted for routine surgery or for cancer therapy or any of the other things. And many of these individuals are being found to have concomitant Omicron positivity, and they have to be shifted. And it is these patients. So the important lesson is deaths are likely to occur. We are not to be complacent, but the individuals with comorbidities need very close vigil, close monitoring. And if we have somebody who has contracted Omicron or COVID at this time and has comorbidity, probably these are individuals who require hospitalization.
Dr. Arora, there are conflicting reports in terms of what really is causing this surge. Is it the Omicron variant, or is it the previous Delta? Or there are also certain reports suggesting that there are siblings of Omicron which have emerged in terms of BA.1, BA.2 and BA.3.
I think we should understand a little bit what has been happening during last 6 months. So in May, June, it was almost 90%, July 80, 90%. Gradually in October, November, Delta became about 40%, and so-called Delta Plus, AY series became about 50, 60%, okay? And then as December comes, the Omicron starts coming. And what we are saying is that the epicenters of this outbreak, like Delhi, Mumbai, Kolkata, Pune, Ahmedabad, where the proportion of Omicron has increased up to 90 or more than 90% also, but at least 70, 75%. And so the other individuals are less at the moment, in terms of genomics, genomic surveillance is telling us. But the point you are raising is very important. Some of our states, like northeastern states, or some of the districts in Tamil Nadu and other places where Delta is still is quite important, and Omicron has really not affected so much. So, but grossly speaking, overall, the country is having Omicron outbreak. Most of the outbreak cases are because of the tsunami of cases we are seeing is probably Omicron, because just around November or December first week, we had reached up to 6,000 cases a day. And therefore, Delta is something which most of us have been already exposed. Adults, because children are 80, 85% positive. And it is a proxy marker that even adults are naturally infected by Delta or so by 80, 85%. So therefore, whatever we will see at the time will be mostly Omicron driven.
And it is also being seen that as far as the oxygen as a resource is concerned, critical medical resource is concerned, that is not there in this particular wave. Could you explain this phenomenon to us? Because the government had invested a lot into building that entire infrastructure for oxygen.
First of all the investment in health structure and strengthening is so welcome. We were waiting it for last decades, several decades, and this strengthening has occurred, and COVID has kind of driven that. Now, coming to the oxygen need, the physiology and the biology of Omicron suggests that most of the time the viral infection is in the upper respiratory tract infection, and the reports from the hospitalized individual is that viral pneumonia is quite uncommon, and viral pneumonia causes a great need for oxygen. Delta was really affecting the lungs, main lung, or which is called lower respiratory tract infection, and oxygen requirements are very high. On the contrary, Omicron is mostly restricted to the upper respiratory tract, and very few cases of viral pneumonia are being said. So that is the basic explanation, that oxygen requirement is less, and that is what it also makes it less severe disease.
And what about the peak? Because there are several forecast models that I've been reading in the last 24 hours that have been talking about that this particular wave will perhaps subside towards the end of February. What's your own assessment?
I have seen some of these models, and I think today or yesterday there was somebody from IIT Kanpur also. There has been a model suggested. These are, I would say, good guides, but the peak will be dependent on three things. One, how good we manage corona appropriate behavior at individual and community levels, social gatherings, individual level, how well we are using mask and all those things. The second is some of the containment issues. So last week, like Delhi had 2 days of curfew, and many of the states are following night curfews and some of the other restrictions. Now, many people think that how does it help? The question is, if out of 7 days, on one day, if I just stop all activities, the virus transmission is affected by 15-16%. Yeah. So that also will
Yes.
make a difference in terms of the peak achieved, duration of high level of transmission, and then the subsidence of the wave. So these are a lot of moving wheels, and it will be quite challenging to say that it is January end or February end or March. So there is a lot of effort has to be made that the peak remains within control so that health system can manage all the cases. But the way the virus is there, highly infectious, large proportion of individuals are likely to get infected because it overcomes or breaks the vaccine protection. It breaks the previous natural infection. So breakthrough infections or reinfections are particularly common. The question is how well we manage it.
Okay. Okay. Okay, let me bring Dr. Joshi now. Dr. Joshi, you have predicted the peak. You are among those doctors and healthcare experts who has predicted a peak and how many cases we'll be witnessing it and when it will start subsiding. Simultaneously, there are reports that are coming in, Dr. Joshi, that are talking about the siblings or other variants of Omicron in terms of BA1, BA.2, BA.3. Will we be seeing that surge being propelled further by these variants? Or is this just the beginning of an end that we are looking at? Or are you of the opinion that this is almost like a cycle that we are in?
I'll take your second question first. The Delta also had derivatives. Similarly, Omicron can have derivatives, but the trajectory will remain the same. So the Omicron, as Dr. Arora said, is a very contagious tsunami-like spreading virus, which has three characteristics. The doubling time is almost down to 1.5 to 3 days. The rapidity of spread is also witnessed by the immune escape failure, both for natural infection and vaccination. But the challenge is that virus doesn't follow any mathematics. As far as Mumbai city is concerned, we had predicted the wave to be somewhere around 15th of January. But the testing is saturated. So we are not going to get true numbers, but our test positivity rate today also is 25%. But today our cases must have dropped down to 13,000 cases. So obviously from 20,000 we have dropped down, and that is maybe because of a Sunday effect. And also remember, our testing labs could be saturated. So we will definitely peak this week for sure. Probably Delhi should have followed us, but Delhi has already overtaken us. So currently the mathematical models are not very correct. Maharashtra is likely to peak in the 1st of February, and India likely to peak around 15th of February. But that will depend, as Dr. Arora said, on several factors like micro containment, where the virus is, because the main thing in this Omicron is 80 to 90% of people are asymptomatic, and therefore the virus is invisible. When the virus is invisible and they are asymptomatic and they are transmitting in the first 5 days when the virus is highly contagious, that is the time people need to optimize, double masking, virus appropriate behavior, COVID appropriate behavior. And that if it happens, and if there is decluttering and decrowding, we will be able to achieve a lot. And all these models can go haywire if we are able to adhere to that. A lot of restrictions, like augmented restrictions, are in place in several geographies of concern. These geographies of concern are Mumbai and Maharashtra, Gujarat and Ahmedabad, some southern states, including Calcutta and of course Delhi and the NCR region. And obviously there we need to ensure that the peak is almost there in a week from now, or maybe almost we are in the week of the peak. And if you follow the South African model, and which is where India is likely to go, then probably we will definitely see a peak. There they had 3% hospitalizations, while in British, if you see the British pattern, they had 6% hospitalizations. So it's likely that if we follow the South African model, we will likely to have peak this week for Mumbai, 2 weeks from now for Maharashtra, and for India maybe 3 to 4 weeks from now. But as I said, virus doesn't follow any mathematics, so most of the models are reasonable but not very accurate. The second thing which we need to recognize here, as far as Omicron is there, there is still some Delta around. So Delta still will be around those 5, 10, 15% of Delta, but there is a large proportion of Delta immunity. So as you said, finally, that are we seeing the end of it? Well, if this virus doesn't impact our healthcare infrastructure, we have zero COVID deaths, we have a less severe disease, and then obviously, unless and until there's a new variant of concern, and even if there is a new variant of concern in the future, if it is less virulent like the Omicron variant, then probably we will see endemicity. And probably by March, we will see the end of this so-called tsunami-like wave. If we follow South African
particularly coming from Maharashtra, since you are a member of COVID task force from Maharashtra, I want to understand this sublineages which are being talked about, where the BA.1, where it is believed to be the clinical samples have been collected, and they are talking about these are sublineage from the original Omicron variant. What do we know about these mutations?
So I don't think we should put too much to that. See, the clinico-genomic correlation will, the genomic scientists will keep doing that. Similarly, for Delta also, there are, children of Delta, grandchildren of Delta, which is being seen all over the world. I don't think, but basic behavior of that particular strain or that lineage is going to be the parent strain. So obviously, the Delta behavior is very different from Omicron behavior. So even if there's an Omicron derivative, and if it is less sinister than even the South African or the British variant, it may be useful. I think it is too early to say. And always remember that hospitalizations and death follow after 2 to 3 weeks. So we need to be a little more cautious. We do not need to be complacent. We don't need to dismiss the current, tsunami-like wave as a mild variant. We need not to miss those deltas. We need not miss those vulnerable groups which are deteriorating. But most of the people who will have Omicron will do well with simple symptomatic treatment. That's the message. But we cannot be complacent. We cannot allow more explosive spreads of the same. And that's something which we need to contain. And I don't think we should put too much to those sublineages here from a clinical standpoint, because the contagiousness and the virulence, both of these factors may not be totally impacted. For example, when the Delta derivative like Delta plus came, later on we realized that Delta plus was actually a Delta minus from a behavior standpoint. And it was less sinister than the original Delta. Similarly, let us hope and pray that the so-called Omicron derivatives, which have been discovered by the NIV, and it's very premature and it is conjunctural, we should not get into any speculation. Let us see the evidence base. Evidence base needs time. It will evolve over the next 2 to 6 weeks, and we'll get better data then.
Fine. Dr. Garg, I've been looking at certain reports, and there is this Harvard Gazette, which is talking about particularly about the boosters, which has begun in India, which is being called a precautionary dose. And they are emphasizing on mRNA-based vaccines, which is perhaps the best vaccine and most effective against Omicron. My question to you is, ma'am, when we look at these doses, we were earlier told that if you have 2 doses of vaccines, you're thoroughly protected. It's like you're fully ready to go. You'll be able to beat the virus. Are we looking at 3rd and 4th? You may call it booster, additional, or precautionary, as India is calling it. Are we looking at more doses and for better preparations beyond Omicron?
Mare, it's a very, very important question from a public health perspective also. All throughout, we have been talking about that India has got huge surge of natural infections. So both the doses what we give, whether we gave one before and subsequently we gave one after the infection, that served as a booster dose. We have to remember that. Most of the countries have only relied on the vaccination, whereas in India we have relied on the natural infections as well as booster doses. So it is important to look at, from that perspective. So I will say that as of now, that is why we are calling it as a precautionary dose. Though it will boost up your immune mechanism, but this is a precautionary dose. Another thing is that you see some of the countries have started giving fourth dose also. We have to call it somewhere kind of a, rather than focusing on the basic public health measures, that is COVID appropriate behavior. Again, looking at those individuals who have received only one dose of vaccine, like we have been analyzing the data that still amongst the healthcare workers, frontline workers, people are yet to receive 2 doses of vaccine, or amongst the elderlies also. So we need to focus first on that.
Yes.
And then, we need to decide upon our strategy that whether we'll be needing. And as of now, I will say that, this much of infection compounded by infection with Omicron, which is an exponential rise, not only, kind of a horizontal rise, which will definitely take care of the situation. But we need to wait and watch, as both, Dr. Arora and Dr. Joshi have said, that we need to be watchful about the total situation. And India also, remember, is in a transition phase where we have got huge chunk of population now, which is above 60, because in India also is more or less kind of,
Yes.
going towards the developed country where our life expectancy is increasing. So we need to follow all the COVID appropriate measures. And remember, our evidence of this precautionary dose is science-based and epidemiology-based.
Okay. Dr. Leharia, taking that argument forward, because there is a comment by Suzanne, who is a professor in infectious diseases at the University of Oxford, and she has said that it certainly looks like a 3-shot vaccination schedule will be needed against Omicron. So does it mean that this particular shot that is being given in India will also mean that in a new variant there could be another one? And of course, this is coming at a time when India has begun vaccination for the teens between the age group of 15 to 18. But what about the toddlers, the most vulnerable? Because we have seen the South African model where those who were infected because of Omicron were those who were unvaccinated. They were largely the children or the youth in that age group.
So in COVID-19 pandemic, especially in context of COVID-19 vaccines, we cannot compare one country with another country. The reasons are manifold, including each vaccine is different, what immunization or vaccination schedule that country has used, what has been the course of pandemic in that setting. All of this determine that the level of protection immunity in that setting. So if a country is using mRNA-based vaccine and then they decided to give a booster dose, is very different than a country which is using Covishield or Oxford AstraZeneca vaccine. So India's situation cannot be compared. Like we cannot take a copycat example from United Kingdom or United States or any country that this is the policy India should follow. We know what we know, and there is enough scientific evidence to understand that if there is a natural infection, which was the case for India in April, May during the second wave, and followed by 2 shots of vaccine, which is a hybrid immunity far better than mRNA-based vaccine being given in booster shots. What we also need to remember that the countries which have given booster shots are not doing any better in the Omicron wave than the country which have not given. So to me, in the Indian context, one of the core messages is that if Omicron surge indicate anything, it indicates that people should receive their first and second shot. Booster has its own role, but it's not related to Omicron. Now coming to the adolescent, the older children, 15 to 18-year-old, which are being administered vaccine, I think
Yes.
at some point of time, they would have been administered the vaccine. Indian government had made a decision considering of many other factors. So this is a good beginning, and I believe that it will provide protection to additional subgroup of population. Of course, at this stage, key that we need to provide any high-risk population group with 1 and 2 shots, and amongst all the children in 0 to 18 years, all of those are low risk, but within those children, 15 to 18 are highest risk. Ideally, the high risk children in 15 to 18 should have been given COVID-19 vaccine in the beginning, but operational feasibility that all children are given vaccine. So this is a good start.
Okay.
But a final point I want to make is that we at this point of time need to separate Omicron wave from the booster shot discussion. Booster has its own role, and 2 shots of vaccine continue to provide protection.
Okay, let me give the final words to Dr. Shashank Joshi. Dr. Joshi, what do you think will be something that you will be watching out for in the next 2 weeks till January end?
clearly we'll be watching out for deaths, people who need ventilator, people who need oxygen, and particularly the ones who have a gene deletion or are confirmed Omicron. That is going to be the critical determinant factor and the discriminant factor, which will be the main thing which will tell us the outcome. And if that is going to be simple and reproducible, like what happened in South Africa, which is mild disease, no major severe disease, and very low death rate, then I think we are in good shape, and that's something which we need to recognize. Second thing which I will walk out from a public health standpoint is how much percentage from the genome or INSACOG the Delta is being replaced by the Omicron or the Omicron derivatives. So if the Omicron or the Omicron derivatives have more than 95% replacement across all geographies of India uniformly and not heterogeneously or in a scattered way, then we clearly know that we are dealing with a highly contagious but a less virulent virus, and eventually we are heading for an endemic zone. So next 2 weeks from those standpoints, one is from the mortality and severe disease standpoint, and second from a public health standpoint of how much of the replacement of Delta will be occurred. If the replacement is total, and if the death rates are very low,
Dr. Arora,
severe disease is very
Dr.
low,
Joshi,
and probably then it's a very reassuring thing.
All right, Dr. Joshi, thank you so much for joining us. Dr. Arora, Dr. Garg, and Dr. Laharia, thank you so much for sharing your thoughts on this wave that we are seeing with the surge in cases that we have witnessed in the last 24 hours, the highest in 7 months. This remains our top focus here on CNN News 18. That's all from me. I'll be seeing you tomorrow. Thanks so much for watching.